This is the introduction to our inferior shoulder dislocation assignment. So an inferior shoulder dislocation is actually the least common of all dislocations. It's about 1% of all dislocations. It's also called luxatio erecta, and it is when the arm is stuck in a permanently hyperabducted position. It will present after the injury as the arm up and behind the head often because the forearm will get tired. So it's when the arm, usually because of a fall, is hyperabducted. So it's like this, and it is pushed, the humeral head is forced into the acromion. And this is how the dislocation occurs.
Okay, Matthew, is it all right if I take your blood pressure? Super. So you're just going to feel a little bit of tightness around your arm as the band expands. And I'll be taking your radial pulse. So what's your blood pressure normally?
I usually have pretty low blood pressure. It's usually around or under 110, over 70, high 60s.
Okay, it was 109 over 70. So that's pretty normal for you?
Yes.
Okay.
Hi Matthew, so I have your health history here in front of me, so I'm going to ask you a few questions regarding your injury. So have you ever had a dislocation, a subluxation, or any other pathologies in your shoulder?
No.
Ever? No? When did the injury occur?
It was just 3 weeks ago.
Okay. How did it happen?
I fell off from the ladder when I was working, and then it happened.
Okay. Did you hear any significant sounds, like a popping or
Yeah, I heard a pop sound when I was working and when I fall down from the ladder.
Okay. So what exactly was done at the time of the injury?
My colleagues called the paramedics, and because I had a pain, all they told me was to breathe and relax.
Okay.
That's it. And they told some medication, but I don't remember what's the name.
Okay. So they probably gave you some medication for the pain until you got to the hospital. So you did see a doctor?
Yeah.
Okay.
But they referred me to a massage therapist later.
So how was your dislocation addressed at the hospital?
My shoulder just popped it back.
Okay.
And then just it happened.
Okay, so they did a closed reduction. There was no surgical procedure?
No.
Okay. So are you seeing any other healthcare practitioner, like a chiropractor or a physiotherapist?
My doctor prescribed me, referred me to the massage therapist.
Okay.
So I was seeing massage therapist from then.
Okay. And are you using this sling like 24/7? Have you had any breaks?
I'm using my sling all day and night, and I'm on medication with the Tylenol. So I'm having a little bit relief, but not exactly.
Okay. So for the treatment, are you comfortable with us removing it?
Yeah.
And working on some ranges of
Yeah, I'm
motion?
comfortable when you're talking.
Okay, great. So while at work, what common activities and motions and things are you usually doing?
Because I'm a painter, I carry lots of heavy bags and painting bottles. So I have to work like this. all the day, and it gives lots of pain for me.
Okay.
And I also drive a lot to and fro from my house, so it pains a lot for me.
Okay. So do you play any sports? What are your hobbies? Are you active?
Yeah, I play touch football
Mhm.
and the baseball.
Okay. So in touch football and baseball, what position do you play?
I'm a quarterback and a pitcher, so I do use my arm a lot, and because of that, I have a pain.
Okay. All done. Okay, so I'm just going to ask you some questions regarding the pain that you're experiencing. So, what symptoms are you experiencing exactly?
I have dull and achy kind of pain, and the pain is almost constant every day.
Okay. Are you experiencing pain right now as we're speaking?
Yeah,
Okay. Can you isolate the point, like the part of where your pain is?
yeah, the pain is here,
Okay.
and it's constant.
Okay.
Even now, I'm feeling the pain.
Is it referring or radiating anywhere?
No.
Okay. Can you describe in a word what your pain feels like? Like, what's a descriptive word?
I feel the pain every day, like constant pain. It's like dull and achy.
Is there anything that aggravates the pain, makes it worse?
Yeah, when I'm walking in the morning, and when I woke up every day in the morning, the pain is more, and after some time, it decreases in the evening.
How about when you're showering? Do you feel anything from the temperature differences?
Yeah, when I'm showering, I feel that because it's more heat, I'm feeling more pain since the last 2 weeks.
Okay.
Yeah.
All right. Are you taking anything to relieve the pain, or are you doing anything to relieve it, like
I'm just taking the Tylenol.
Tylenol?
Yeah.
And what position are you sleeping?
I'm just sleeping towards my side because my right hand, like my left arm, is paining. So I'm using most of the time my right arm, and I feel so
Sleep on your
exhausted because of that.
Okay. So, what activities are specifically, like, of your daily living very hard to complete?
Because I'm a painter, I use most of my right hand, and because my left arm is not properly functioning, so I'm doing each and everything with my right hand, and I feel so stressed out and very much painful.
Okay. Is there anything that's impossible for you to complete with this injury?
I'm not able to do my daily activities with this.
Okay. All right.
Okay, so Matthew, before we start the treatment today, we're going to have to perform an assessment first. The reason why we have to do assessment is so I can provide you with a safe and effective treatment. It will help me to kind of get an idea of what the problem is. If you choose not to do the assessments, then we may not be able to continue with the treatment because it may not be safe. Do you have any questions? Do I have your consent to assess? And also as well, while we're doing the assessments, the purpose is to reproduce your symptoms. So please at any time let me know if it becomes too discomforting. But again, we won't be able to continue with the treatment if you choose to stop. So during the assessment, is it okay that we take the sling off? So first I would do rule outs. I would rule out the C-spine, and I would rule out the elbow.
Okay.
And I'm only performing active and passive ranges of motion. Resisted at this point is contraindicated, and as well the passive ranges of motion, we don't want to put him into the full ranges. Only into where he feels less pain. So I'm going to get you to do some ranges of motion of your neck. If you just copy the motions I do, and I'm going to apply some pressure at the end. Please let me know if it becomes uncomfortable, and we'll stop. So can I get you to bring your neck to the side? Any pain or discomfort?
A little bit of pain, but not too much.
And can I get you to bring your neck to the other side? discomfort with that?
Just a stretch of the muscles.
Okay. And can I get you to bring your chin to your chest? Any pain or discomfort?
No.
And can I get you to bring your neck back, head back? Any pain or discomfort?
A little bit, but not much, just my muscles.
And can I get you to look over your shoulder? And any pain or discomfort?
No.
And can I get you to look over to the other side? Any pain or discomfort?
No.
So the spots you indicated pain, can you just show me exactly where?
Just in my muscles in here, I could feel it was stretching a lot and a bit of pinching.
Okay. So, Matthew, I know you said it's okay to take the sling off, so I'm going to take it off now, and I'm going to get you to do some motions with your elbow. Is that okay?
Yes.
Okay. So I'm just going to hold your shoulder, make sure it's stable. And can I get you to bring your arm up like this, like you're doing a bicep curl?
It hurts to extend.
Where does it hurt exactly?
It hurts up in here a little bit, referring from my bicep muscle.
Okay. And I'm just gonna add a little bit overpressure. Is that okay?
Yeah.
And can I get you to bring your elbow out like this? Any pain or discomfort?
A little bit. Yeah, it hurts to extend a bit.
Is that okay?
It's okay.
And then if I can get you to bring your palm face down. Any pain or discomfort?
A little bit, but it's okay.
Again, where is the pain?
The same area, but more on the tricep.
Okay. And can I get you to bring your palm upwards to the ceiling? Any pain or discomfort?
Same kind of pain as the flexion movement. That one hurts in my shoulder.
Okay. So the reason why we are doing rollouts of the cervical spine and the elbow is to ensure that during the injury there were no other injuries to the other joints surrounding the shoulder. Our client Matthew did feel pain in some of the movements, and that is due to him being in a sling and those muscles of the neck compensating, as well as the elbow joint muscles being shortened for long periods of time in the sling. So now we're going to be doing some ranges of motion of the shoulder. We're only doing active and passive in mid-range, not to the full range. I'm going to be using a goniometer so we can see the level of improvement with every visit. Okay, so now Matthew, I'm going to ask you to lift your arm up as much as you can, but without forcing yourself too much, because we don't want to cause too much pain. So if you can just lift your arm up. Okay, so there's only 50 degrees range of motion. That is significantly reduced for shoulder flexion, which is around, I believe, 180 degrees. So now we're going to do extension of the shoulder. So Matthew, I'm going to get you to bring your shoulder back as much as you can. Again, being cautious not to force yourself too much. And I'm just going to measure. Is that as far as you can go?
Mm-hmm.
Okay. So we have about almost 10 degrees of extension. Normal limits are 60 degrees of extension. So again, there's significant reduction in range of motion of extension of the shoulder. So now I'm going to get Matthew to do external rotation, and as well internal rotation. So first, Matthew, can I get you to bring your arm out like this as much as you can? Okay, so it has about 30 degrees of external rotation. So now, Matthew, we're going to do shoulder abduction, which is, I'm going to get you to bring your arm out from the side and up like this, but only to the point where you feel pain.
This is hurting me now.
Okay, so you have 50 degrees of range of motion. Regularly, shoulder abduction is around 180 degrees. So now we're going to do a adduction of the shoulder. So can I get you to, Matthew, to bring your arm in like this? So there's about 25 degrees of adduction. And for horizontal adduction and abduction, I wouldn't get Matthew to perform these because he's having trouble even bringing his shoulder up into abduction, so we wouldn't be able to do those ranges of motion. Okay, so now I'm just going to take Matthew through some passive ranges of motion of the shoulder. And again, I'm not going to put him to the full range because we may re-dislocate the shoulder. So I'm just going to take you through some motions. If you want to sit down, please let me know as soon as you feel pain and we'll stop at that point. So
Ow. Yeah, that's painful.
And where is it hurting exactly?
In this area.
And bring your arm back.
Yeah, ow. Yes, that hurts there.
Same area?
Same area for everything. Same area. That hurts a lot. Yeah, same area. That's
So because the mechanism of injury is known, Matthew fell off a ladder and dislocated his shoulder, and then it was reduced by professionals. I would not perform any special tests that would test for shoulder instability or shoulder dislocation because of the risk of re-dislocating that shoulder. As a massage therapist, I would not want to take the risk or affect the safety of my client by performing such special tests. For the functional assessment, we asked Matthew what was important to him in his daily activities. Right now, he is compensating with his right arm. He's doing most of his activities that he usually does with only his right arm. So washing his hair or picking up groceries is all done with the right arm. So he's having significant pain in these muscles because they are becoming overworked. So one functional outcome would be that we want to decrease pain. in these muscles so that he can perform these actions. As well, Matthew is a football player and he is a baseball player, so this motion in both sports is used. So rotator cuff muscles, they're going to be obviously injured, and we want to maintain range of motion and eventually get him to significantly have the same range of motion in these muscles so that he can perform in his hobbies. Okay, so as part of assessment, we have to do palpation. Palpation helps us to feel the difference between the affected and unaffected side. But in the unaffected side, as I'm palpating, I will feel some tightness and tone, hypertonicity in the rotator cuff muscles, in supraspinatus and infraspinatus, because these muscles are compensating for the affected arm. The client is using the unaffected arm for daily activities such as washing hair, lifting groceries. So all of the muscles on this arm are also going to be tight and hypertonic in the deltoid area as well. Coming into the suboccipitals and the upper traps, they also feel hypertonic. There's increased tone as well. I can feel top bands of muscle, as also in the scalenes, because the neck is in a flexed position due to the sling. So these muscles will be shortened, and there is probably trigger points within these top bands of muscle. On the affected shoulder, as well, the rotator cuff muscles, they also feel ropey in texture, and they also feel hypertonic, probably due to protective muscle spasming, muscle guarding. And coming over to the lateral side of the deltoid, there is decreased heat because the injury is at the stage where there is no inflammation present, or maybe a little inflammation. It does feel a little cool, possibly due to some ischemia in that area. How does it feel, Matthew?
A little bit tender.
So it will feel tender around the area of the trauma.
The nature of our treatment is to focus on helping you reduce your pain in your shoulder and increase circulation, reduce edema. I'm going to be working on your head, neck, and shoulders. I'm only going to be undraping the areas that are necessary to be undraped. And the benefits of this will of course help you reduce your pain, help you reduce any tension, any trigger points that are causing you any pain. If you decide not to have this treatment, all these trigger points and tensions could get worse and cause you more pain. You might feel a little bit sore the next day, which is normal. It'll usually pass by the next day. Also, be careful getting off the table. You could be a little bit dizzy. And if at any time you want me to stop, you have the power to let me know, or if at all you're feeling apprehensive about any work I'm doing, just let me know and I'll modify the treatment to make it more comfortable. I'll be checking in on you periodically to make sure that you're fine and that the pressure's okay. You know, if it's too much, you'll let me know. And if I find anything out of my scope of practice, I'll have to refer you to another health practitioner. And also, do you have any questions? Mm-hmm. And do I have your consent? it okay if I tuck back here? Okay, so what I'm going to start off with is trying to reduce some edema in your shoulder, and I can just feel that there's some on this upper part of your shoulder. So I'm just going to press the note up here and start up here. It's kind of like a little kickstart button for your lymph nodes to be able to take in that extra fluid. And also I need to get under into your armpit a little bit, so I'm just going to lift up in here. Is that okay? That's okay?
Yeah.
Okay, so I'm going to start off with the hydro, and I'm going to start off with the warm. And as that's heating up there, I'm going to do some lymphatic drainage. Is that okay?
Mm-hmm.
Okay, and what I'll do now is I'll put the cold on, and we'll just keep switching them. Does that feel all right on your shoulder there?
Mm-hmm.
You can do some over here. And I would do this a couple times, and although we don't have the time today, but I would probably let this sit for more like 5 minutes at a time before changing. And this would take probably a good 20 minutes. Anyhow, moving on to our next treatment, I would going to do some effleurage over the area, just very, very light. And you just let me know, is there any pain or anything like that when I'm doing that? And I can feel that your upper traps are tight, so I'm going to work into them a bit, and probably into your rhomboids here, and supra and infraspinatus here. And you just let me know if the pressure's okay. Just do some specific kneading in these muscles here that I feel tighter. And what I'll do is I'll get you to lie supine, and I can really get into those upper traps a bit more, especially on the other side where I can really go to down and get into those deeper muscles.
Okay.
Is the pressure okay here?
Yep.
Okay, good. I'm going to do some fascial work now, and I'm going to do some skin rolling and some my direct fascial work to break up the fascial adhesions in the pectoralis muscles. I'm also not using any lotion, as this will impede the success of this. And you just let me know if this is at all too painful for you. We're starting on the unaffected side. We're just going to go really slowly, breaking up all that fascia. I'm just going to do some skin rolling. Again, really slowly. Is it okay? You're comfortable? And we're going to do the same on the other side. So now I'm going to work on your upper traps and your neck and relieve the tension in there. Is your shoulder okay?
Yeah.
I'm just wondering if you'll be okay without the pillow, because I can get under your neck better without the pillow.
Yeah.
Is that okay? So what I'll do is I'll just hold your hand. Oh, that works out perfectly, actually. So you still have a little support under your shoulder. And that relaxes these muscles into. And I can feel a lot of tension in these upper traps. And it probably has to do with the upper crust, anterior carriage that you have. Because all your pec muscles are tight, your traps. Oh, and I just found a trigger point. So when you find a trigger point, I had a twitch response, and I feel a top band, and I'm going through the top band, and I feel adhesion here. And do you feel local tenderness here? Yeah. So what I'm going to do is I'm going to put some pressure, and you let me know that it doesn't go past 7, and you let me know when it goes back down to a 3.
Okay.
Okay? And what I'll also get you to do is maybe stretch your neck out this way, and I can get in there a bit more. You okay?
Yeah.
And you feeling it release?
It's starting to get better.
I usually hold this for a lot longer, but with our time today, we don't have that much time. But and I'd also repeat that 2 or 3 times, as long as we could handle it. So I'm just going to strip the muscle to flush out any toxins from that trigger point. A nasty one, eh? Sorry. Okay. So also this shoulder must be killing you from all the overuse.
It is.
And I'm just going to do some muscle squeezing. do just kind of a little more motion. I'm just going to put your head straight, sorry. On your neck a bit. Stretch out the muscles in your neck a bit with some posting. And just try to relax your head into my fingers. Have you been getting headaches at all?
No headaches.
Sometimes when you have trigger points in here, they can refer into your head and cause headaches. Does that feel alright?
Yeah, feels nice.
You can just relax your hand into my fingers again. Okay, Matthew. So that's our treatment for today, and what I would recommend is maybe once or twice a week to come back for maybe 25 to 35 minute sessions. And once we get your muscles toned down in here and the swelling down in here, then we can start, and you get a little bit more range of motion in your arm. We can work on that, and then we can start working into the deeper muscles that probably got very pulled in your accident. Okay? Okay. All right. I'm just gonna go wash my hands, and you can get dressed. If you need a hand, you just let me know.
Hi Matthew, today I'm going to explain you the home care things which I wanted you to perform at the house. Because your ligaments are weak and there is less blood circulation, I wanted you to do the contrast hydrotherapy because it increases the local circulation on your shoulder. And I also wanted you to do some strengthen exercises to increase the range of motion. And I also suggest you to take lots of water because it helps for the blood circulation, as well as it helps to decrease the pain as well as the blood flow and everything, like increase the blood flow. And I'm going to tell you the pendulum exercises as well as the band exercises today. So okay Matthew, I'm going to explain you the pendulum exercises first. For the pendulum exercise, because your right arm is unaffected, I wanted your right arm to be stable on the table, and then take your left hand, and because is it affected, I wanted you to do the pendulum exercise like this. First in the anti-clockwise direction in a small circles, like 1, 2, 3, and I also wanted you to do in the counter-clockwise direction, like 1, 2, 3, and keep on increasing the range of motion in the big circles slowly, so that your range of motion increases and the blood circulation increases and the muscle relaxes slowly. Is that okay? And I'm also going to tell you the band exercises, which also does the same effect, and it's easy. Just take the stick or any other light thing which is easy for you, and I wanted you to be stable like this and do like this and like this, depending on the range of motion. So I don't want you to stress more on your affected shoulder, but just keep that in mind and do it like this. Okay? Thank you. Okay Matthew, I'm going to explain you the contrast hydrotherapy, which I already suggested you to do at the house. So in the contrast hydrotherapy, all you need to do is take one warm towel as well as a cold towel, and I wanted you to use that on your shoulder for 5 minutes alternatively for 10 to 15 minutes daily, so that it increases the local blood circulation. And okay Matthew, I wanted you to follow all the home care principles and the treatments which I told you, and I also wanted you to do the exercises so that by the next week we can find good results, because you're already doing good, and I wanted you to do all the exercises regularly and the contrast hydrotherapy, which really gives you good results. Okay, and should I help you with getting down? I think you should get on
Sure.
slowly. Okay. Okay, I wanted you to get on slowly. Thank you. Take care.